Hi there, and welcome back to the channel. I'm Dr. Avery, and today we're going to talk about a question that comes up far more often than you might think, especially among men over 60 in the US. What is a normal penis size, and how does that change with age? For many senior men, the question isn't just about curiosity. It's about noticing changes over the years and wondering whether something's wrong. And with more talk about cosmetic procedures than ever before, the pressure to measure up doesn't magically disappear with age. In fact, sometimes it gets even stronger. So let's start with a fact that might ease your mind right away. Around 95% of men, even in their later decades, who think they're too small, are actually within the medically normal range. That's right. The vast majority of size worries are about perception, not reality. And here's a myth to clear up early. A lot of men believe size shrinks dramatically after 60. The truth is, while some small changes are common, they're usually minimal, often less than a centimeter over decades. And most of that is due to circulation changes and a softening of tissues, not some sudden drop-off. Another myth? That women care more about size as men age. Surveys say otherwise. In long-term relationships, only about 5 to 10% of women put high importance on it. Emotional connection, trust, and intimacy matter far more. By the way, if you're learning something worthwhile from this video, consider hitting the subscribe button. It encourages us to keep sharing science and data-backed information like this to men like you who really need it. Now, let's talk about measurement. You see, the rules are the same whether you're 25 or 75. The most reliable way to measure length is in what's called the flaccid stretch state because it predicts erect size accurately. That means using a ruler or tape, placing it right against the pubic bone. Yes, pressing in past the fat pad a little, gently stretching, and measuring to the very tip. When erect, you do exactly the same thing, starting at the bone and measuring along the top. Measuring from the skin or underneath adds false length, which is one of the biggest reasons men get unrealistic numbers in their heads. Girth, or thickness, is measured with a soft tape or a piece of string around the middle of the shaft. In research, they usually use the erect measurement, but you can do both flaccid and erect if you want to see the difference. And here's an age-specific reality check. Many senior men compare a relaxed flaccid size to someone else's fully erect size, which is like comparing a parked car to one going full speed. It's never going to be a fair match. Now, the numbers. Large-scale studies that included men across age group and including older men, show that about 90 to 95% fall between 10 and 16 centimeters in erect length, which is about 4 to 6.3 inches. The average is just over 5 inches. Erect girth tends to fall between 3.9 and 5.1 inches, with the average right around 4.5. A micropenis, by medical definition, is under 3 inches erect. And that's rare at any age unless there's a specific medical cause. So if you're in those ranges, you're in the overwhelming majority. That's a fact. The myth that bigger is always better is something pushed by selective casting in adult films and unrealistic online images. In reality, the human body and human satisfaction works on much broader terms than that. Now let's touch on procedures because curiosity about enhancement doesn't stop at retirement. For girth, the most commonly discussed method today is injecting hyaluronic acid, which is a substance already found in the body. It can add a couple of centimeters in thickness and lasts about a year to a year and a half. It's considered relatively safe, but it's temporary. Permanent fillers like silicone sound appealing, but come with serious risks, lumps, scarring, even permanent tissue damage, and are not recommended by responsible medical professionals. For length, options are far more limited. Liposuction at the base can make more shaft visible, but doesn't actually make the penis longer. There's also a surgery that cuts the ligament attaching the penis to the pubic bone. It can add some flaccid length, but not erect length, and it may even reduce stability during sex. And here's a myth to crush. Penile implants, which you may see online, are not for making a penis bigger. They're a treatment for erectile dysfunction and only used for specific medical reasons. Now, here's where I like to put things into perspective. In ancient Greek and Roman art, the ideal male body was often shown with smaller genitals, and that was linked with wisdom, discipline, and control. Larger sizes were often portrayed in comedy or linked to excess and a lack of refinement. That tells us something important. What's considered ideal is cultural, and it changes over time. So much of the pressure you might feel today is a product of the era, not a permanent truth about manhood. So if you're a senior man looking in the mirror and feeling unsure, remember this: you're probably completely within the normal range. Even if time has brought some small changes, those changes are natural, common, and don't define your masculinity or your worth. What matters far more now than always is your confidence, your health, and your connection with others. If this has given you a bit of clarity, go ahead and like the video, subscribe, and turn on notifications so you don't miss the next science-based, judgment-free conversation. Thanks for listening. I'm Dr. Avery, and I'll see you next time.